Okay. Good morning, everybody. Today's Tuesday, June 16th, Sedgwick County staff meeting that we do on Tuesday mornings, 9 o'clock. So welcome everybody to that is watching online. And with that, I'll hand it over to our manager.
Good morning, Chairman and Commission. Just a couple of items this morning. One, just a quick budget calendar update. We met with all of you yesterday to kind of talk about the continuing formation of the budget and got some ideas from all of you individually. We will piece that together and come back with a recommended budget on July 15th for the Commission to begin to review. On July 22nd, we will have a public meeting for the citizens of Sedgwick County. That will be at our usual meeting at 9 a.m. And then on August 10th, we will have our second public meeting. That will be an evening meeting, 6 p.m. In this room for our second public notice, and then a consideration of ratification of the budget at the August 12th, 9 a.m. BOCC meeting. So that's just kind of an update on dates and times of the budget. And then the only other item for today is the COVID update, and Adrian will start us off and kind of give us a current state of numbers and status. Tim will talk about testing and spend a little bit of time talking about the random testing, which will be taking place in just a few days later this week. And then Dr. Mins is here, and I think we want Dr. Mins to talk about a couple of items. First of all, on May 27th, the Commission voted to continue or to suggest as a guideline the Ad Astra plan from the governor. It was non-regulatory in nature. It was a guideline suggestion only. On June the 5th, Dr. Mins basically put out an opinion that he thought the guidelines should keep us in phase 2 with a gathering size of 20. And that led to a little bit of confusion. I think it's okay because neither are regulatory, but we wanted him maybe to talk about that today, what his rationale for that was. June 8th, just to finish that date sequence, June 8th was the phase change between phase 2 and 3 under Ad Astra. And then June 22nd is the phase out under the existing governor's plan with all numbers and everything being consistent. So wanted to give Dr. Mins a chance to talk in person about his opinion of his decision on June the 5th. And then recently, within the last few days, we had a discussion with Commission a week or so ago about antibody testing. Dr. Mins was on speakerphone that day and gave an opinion that it wasn't the most reliable testing out there. But with this within the last few days, it looks like antibody testing is within the state of Kansas testing plan. So I wanted Dr. Mins to give us an update on that and any status change regarding antibody testing. So if we just go in that sequence and let Dr. Mins field those hard questions, it might move a little bit more smoothly. So Adrian, why don't you start us off?
Adrian, you're up. Adrian, you're up.
Good morning, Adrian.
Good morning, Commissioners and Board of Health. Adrian Byrne, Health Director. Good morning. So today's COVID-19 case counts in Kansas show that we have 11,419 cases, and in Sedgwick County we have a total of 764 cases. Out of those 764, 499 people have recovered, and 25 people have now died. We continue to provide daily updates on our Sedgwick County number to the public through our data dashboard. Now, last week I did mention that to help monitor COVID-19 trends in the county, in the community, that we would be having a business link on our Sedgwick County website through the Health Department, through our COVID-19 link, for businesses to be able to go on if they wanted to voluntarily report on a weekly basis how many of their employees were ill. And so we are finalizing our testing of that today and tomorrow, but the link is live. And so we will be contacting businesses to ensure that they are aware of that should they choose to participate. And they can feel free to call me if they have any questions about that. And then just a reminder, as we continue to reopen our businesses and our gathering spaces, to remember the recommendation of social distancing, physical distancing of 6 feet, and continuing to cover our coughs and sneezes, and to wear a mask if we can't social distance of 6 feet, as well as wearing a mask when we're in a big box store or grocery store. And sometimes, even if we feel really healthy, it can also be a sign of respect for those that may have chronic diseases or conditions or underlying conditions that can create them anxiety as well. So just remember those recommendations, and to keep the fingers away from the eyes, nose, and mouth. And that is my report for today.
Okay. Is there any questions? I don't see any, Adrian.
Thank you.
Thank you much. Morning, Tim.
Good morning, Commissioners. Tim Coppin, Deputy County Manager. The testing report for last week is good. We tested a total of 389 folks. 53 of those we tested at the mobile site in Clearwater. And of the folks that we tested last week, approximately 40% were asymptomatic and 60% had symptoms. And so we're getting a nice mix of both right now to do those tests. And we continue to encourage anyone who's interested in testing, either because they feel if they have symptoms, or if they just like to be tested, to call our 211 number, and they'll go ahead and walk them through that scheduling process and get them scheduled, and make them aware of the mobile sites that we've got going as well. So last week we were in Clearwater. This week we will be in Mulvane, and next week we'll be in Valley Center, and then we'll continue to move those sites around the county and try and touch all parts of the county that way. As I mentioned, we had 389 tests last week. Our mobile testing is going well, and then this week everybody's geared up for the randomized testing that will be Thursday, Friday, and Saturday at our West Central site. So we've got the firm making those calls and getting folks scheduled right now, and we'll continue to do that throughout the course of the next few days. We have called for volunteers to make sure that we've got enough folks to work. We'll be working roughly 8:30 to 3:30 on Thursday and Friday, and then a little bit longer on Saturday. So to give everybody an opportunity to get through, and we've sought out different volunteer groups to help us manage that. That's going to take a lot of staff to make that happen, but we've got a good response there as well. And finally, in terms of supplies, we continue to receive small shipments of supplies, and right now we've got 12,377 kits. Again, we'll use a number of those this week. Hopefully we'll go through 1,700 or 1,800 kits this week. Be happy to answer any questions you may have.
Okay.
I have a question.
Yes.
Do you
Commissioner
have the
Cruz.
full, so Mulvane this week, Valley Center next week, what's the plan for the weeks after that? Can you,
I don't have it in my head. We'll get it sent out. I know Adrian has sent as we get those firmed up with different communities. I think we're back in Clearwater the week after we do Valley Center, and then I don't have it in my head where we're at, but we'll get that sent out to you.
okay.
So if you wanted to repeat, so the random testing that we mailed out to everybody and made phone calls, those are scheduled for, so the public is reminded.
Thursday, Friday, and Saturday. Now, we'll still be able to test
This week.
folks of this week. If people have symptoms and they need to be tested, we'll still be able to work them into that process. But if you're not showing symptoms and you just want to get tested, we probably won't see you on Thursday, Friday, or Saturday. We'll schedule you further out because we want to save slots for those folks that we're doing in the random test, and then for folks who have symptoms, we still need to get those folks tested.
So do you think the numbers will show that we'll get 1,600 people here?
Yeah, that's what we plan on, and I think that we'll see that.
Okay. Good stuff.
Mr. Chairman.
Yes, I'm sorry. Commissioner Dennis.
Thank you. We talked briefly about maybe having all 5 commissioners do something for the test here in the near future to have a media event so that we could get the word out that we are doing this. Is there anything scheduled or set up for a media event for the commissioners to get tested?
I may let Tanya jump in too. We were talking about that just a few minutes ago, and there's a couple strategies there you could consider. One, we could schedule you as asymptomatic testing subjects, or you could go, the mobile van will be each in all of your districts. You could go to your district to be tested too. So it's really kind of your preference. We'll set it up however you want to set it up. I think it is important that commissioners, for a couple reasons, be tested asymptomatically. One, to show that it's easy and relatively painless. And secondly, you're out in public a lot, so it just makes some sense to have you tested. So we can do it a couple of different ways, and however the commission wants to pull it off.
Hey, well, I just thought that with us trying to get 1,600 people, why a media event, if we schedule everybody individually to go through, you're not going to have any kind of media event.
Okay.
The only way to have a media event is to get all 5 of us together and invite the media up to do that.
Let us, after the meeting today, we'll put our heads together on that, and we'll get something scheduled, if that's the preference of the board.
Okay. Thank you, Mr. Chairman.
Okay. Commissioner Cruz.
Thank you. How's the health department doing? I should have asked Adrian, how's the health department doing with all of the calls?
They were behind. They're getting caught up. We brought in some folks from a temporary firm to help us manage some of those calls. When we announced that we were going to be able to take calls from folks that are asymptomatic, we got more calls than we anticipated, and so we're still getting, I think we're all caught up now on those calls.
Well, you're not all called up because no one's called me back, and I called myself. So I called to have a test, and I called 211. I got sent to the health department, and no one's called me back. So I'm concerned about that because I can't even get a call back.
So we are now through all of the symptomatic, because when people call, they go into 2 categories, one symptomatic and one is asymptomatic, and no symptoms. And so we now are caught up on the symptomatic and are handling those live. And this week, the asymptomatic will all be called.
Okay, that's perfect. Thank you. I appreciate
welcome.
that.
Okay.
Hold on just a second, Dr. Mintz. Can you hear me okay?
Yes, I can hear you.
All right, very good. Commissioners, we had a little bit of a miscommunication with Dr. Mintz. He is on the phone, though.
Okay.
Do you want to, we could schedule him for tomorrow to come into the commission meeting and talk, or would you rather talk with him on the phone now?
We have the time right now. I think now would be good. We can just talk to him on the phone.
I'm
That's
fine
all
with that.
Yep.
I believe we need to talk to Dr. Mintz. That's what I said 2 weeks ago, and I still stand by that.
Okay. So let's go forward.
Go forward then?
Yeah,
Okay.
please.
All right. Dr. Mintz, let me turn up the volume here so commissioners can hear. Dr.
All
Mintz,
right.
we had, I prefaced the meeting with the fact that a couple of things. First of all, we wanted to give you a chance to talk about your June 5th statement that basically wanted to keep the county in phase 2. And I wanted you to talk through that. And then a second topic I want you to talk about is the antibody testing, which we had talked about a week or 2 ago, but now it appears like it's in the state of Kansas testing plan. So I wanted you just to address that.
Sure. First of all, on the recommendation I made on June 5th was based on the fact that while our numbers at that point looked stable, they had not been going down. And if you'll go back and read most of the recommendations on the Ad Astra plan, it was hoped that we would be seeing some decline in the cases at each juncture when you made a decision about going from phase 1 to phase 2 and on. our numbers were stable, we're not going down, and I was somewhat concerned about the Memorial Day activities and then the subsequent great number of street protests that we were having involving large crowds of people and what impact that might have on the transmission of the virus. So it was my recommendation to everyone that they continue to behave as if we were in our current phase and not graduate on to the next phase until we'd seen a couple incubation periods pass to see if those group activities would lead to increased cases or not. And as of today, we have seen an increase in cases. We've moved from a stable situation to an increase in cases. And my further recommendation would be to continue in our current phase because all those phases, progression was predicated on the verification that the number of cases was going down. And we've not achieved that. Sad to say, I can't explain. If you wish for me to come tomorrow, we can talk more. Can't explain all the factors. I can't attribute this entirely to Memorial Day activities and the protests that have been going on, but one would have to consider that as a factor. There may be other factors that are leading to the cases not declining. I think another factor we could discuss later is there had been a lot of hope this virus would behave like influenza and become less common as the temperatures increased and the humidity increased, but that has not been the case. This virus does not seem to be behaving like the other respiratory viruses have done, like influenza. So still a lot unknown about the virus, and we're learning as we go. Any further questions about that issue?
Okay. The hospitalization seems to be, though, stable, but the positive cases are increasing, is what you're saying.
Yes.
Well.
Fortunately, we've not seen a major increase in hospitalizations or deaths, but our hospitals are still seeing cases coming in. They're still able to handle it, which is good, but we don't want to let it get out of hand to where they can't handle it. And again, they're not seeing a decline like we had all hoped. It's in the last week or so, it's certainly stable and depends on the day you look at. Some days it's a little more, some days a little less.
Right. But, and so it does seem to be stabilized somewhat, and it is now yesterday was the third week after Memorial Weekend, so it kind of went through a pretty nervous incubation period or whatever period you're talking about. So, Dr. Mins, Commissioner Cruz has a question.
Dr. Mins, can you talk about, I think everyone is concerned, obviously, with our hospitals, with ventilators, those kinds of things, but can you speak to people who do get this virus but aren't hospitalized? Can you speak to some of the things that, how it affects somebody who may not need hospitalization but is still sick from this virus?
Well, like any illness, there's always consequences of being ill and off work and feeling bad enough that you have to stay at home for a number of days. And it can certainly affect you in terms of lingering fatigue afterwards. So it's not like just having a little allergy or something. It is a significant illness. Now, in some people, it's a fairly mild illness, but it's interesting how different people react to this. I think some people feel like the only people that go into the ICUs are the elderly with lots of other major medical problems. And it is true, there's a higher fraction of those people going in the ICU, but we've seen people in their 30s and 40s that are become deathly ill and have had to be in the ICU for a number of days, if not weeks. And at this point, people still don't understand why there's such a difference in age groups. It, in part, is due to other chronic diseases, but we've seen some younger people who thought they were pretty healthy, and there must be something different about their genetics or their immune system. We just don't know yet.
Have you had any information as far as re-hospitalizations for those who have recovered from this virus?
I haven't heard of any documented reinfection hospitalizations. Now, some people if they have significant organ damage, kidney damage or something from a severe infection, they may have to go back in for management of that, but I haven't heard of any true reinfections occurring.
And then one last question. Of the 499 people who have recovered, we have called all of these people, or we're just waiting the 2 weeks, or what is the recovered criteria?
Well, Adrian may want to speak to that, but I believe it's if they've met the criteria of 10 days after onset or 3 days after symptoms resolve, which is ever longer. And in our phone conversations with them, they feel like they're getting better and they're ready to go.
Right.
Adrian, do you have any
Yeah.
differing opinions on that?
Not a different opinion, Dr. Min, just an expansion that we do have daily contact with people that are in isolation and people that are in quarantine that are close contacts. They are contacted by text to ask if they have any symptoms, and so we keep in contact with them as well daily. But the isolation, we call them. And, it was 7 days in the beginning or 3 days after fever and symptom free. But the research showed that the people infected were ill much longer than 7 days. So that's why it was then modified to 10 days. And we find that it can even go much beyond 10 days. So, yes, we are in daily contact with them, and they are at least home isolated for 10 days and sometimes longer, because they have to have at least that 10 days or 3 days fever and symptom free without any kind of medication.
Okay, I'm sorry, one last question. How is the contact tracing going?
It's going well.
Is it,
Yes.
have we hired all the folks out of those 40-some positions? How many positions do we have left to fill?
I believe we have about a quarter left to fill. Human Resources have been doing just a fabulous job of moving them through the system extremely quickly. And those 40 positions were in a number of different roles. Our goal is to have 18 to 20 contact tracers, EPIs, and disease investigators on staff. And so at this point, they are managing all well and staying on top of everything.
Awesome, thank you.
I might add, it's of interest. I haven't looked at the numbers directly, but it's of interest that the reported number of cases in the counties surrounding Sedgwick County are also seeing increases. And as we all know, county lines aren't observed by people traveling. So there seems to be the increases we're seeing is not just Sedgwick County, it's in South Central Kansas. Probably don't know all the factors of that either, but certainly worth noting.
Right.
So your second question was about the antibody tests. I've actually discussed this with Dr. Norman. They want to do what we call a prevalence study to find out what percentage of the population has antibodies. And the antibody test can be used for this, but he emphasized this is not a diagnostic test for individuals to tell them whether they're immune or not. The test has not been shown to be able to do that at this point. It should not be used to tell people that they can no longer get the virus, they're immune, and so they don't have to worry about any of the precautions we're urging people to take. But on a population basis, where you want to get an idea of the approximate percent who have antibodies to this virus, which may indeed be due to previous infection, but still we don't have proof that the antibodies protect them from future infection. So the state just wants to know, in general, what percentage of the population has been exposed and infected with this virus as manifest to antibodies to it afterwards.
Okay, thanks for explaining that, because there has been some confusion about that.
Dr. Benz, when you talked a week or so ago, you talked about the inaccuracy of that test, that it gave false positives. What does the state say on, or is that true anymore, or what does the state say about that?
I'm sorry that this gets a little bit into the science of statistics. When you're using it for individual patient advice, in an area where the prevalence is very low, you'll have more false positives than true positives. However, when you just want to get a general idea of the prevalence of the infection, that is not a huge problem. And if you wish, I can try to explain that when I'm there in person, because it takes some demonstration on a whiteboard. It's a mathematical situation. It's a little hard to explain over the phone. For the purposes of just determining what the infection rate has been, a false positive issue is not as big a problem as it is on advising individual patients. That's one of the problems with the antibody test. Number two, we don't have evidence yet that the presence of antibodies, even if it's a true positive, implies that you are immune to the agent and cannot get it again. We hope to prove that, but we don't have the proof yet, and we're reluctant to tell people that they're immune when we don't have scientific verification of that.
Okay, Dr. Mintz, maybe you should plan on being here tomorrow. We will be having our weekly update on CARES money. Currently in the county testing plan, we do have antibody testing still on the board, but maybe you should be here to explain to commissioners, because I think at some point we need to make a decision whether we're going to acquire these, and we need commission approval to do that. And to make the approval to do that, I think they need a firm understanding of what it will or will not do for us, and that decision will have to come tomorrow. So why don't you, if your schedule allows, plan on being here at 9 a.m. tomorrow. We can have you, we'll get a grease board in here and you can give us a science lesson on antibody testing. Okay.
All right, I'll try my best.
Actually, you could
Anything
probably,
else today?
you could probably come about 9:15. We usually have some preliminary stuff.
Yeah, Doctor, we'll set up an exact time for you, but we do have some
Okay.
Right.
type of preliminary information or preliminary agenda items tomorrow. We'll give you a
Okay.
time to be here.
All right.
Okay.
Anything else today?
You have any questions? Okay. All right. I think Dr. Mintz, thank you. I think the commission has been listening intently and trying to understand the new words, prevalence, things like that. So I think tomorrow will be very, very helpful, and thank you for
Okay.
making yourself available.
All righty.
Thank you, Doctor.
Okay.
Bye.
Okay. Thank you.
That's all I had, sir.
Okay. Does anybody else have anything? Okay. Thank you, commissioners, for being here. Thank you, everybody. Thank you, Adrian, for being here.
What's on the schedule for next week? Do we have we put out the next couple of staff meeting schedules?
We are going week by week. I'll send you an email of what, I can't recall right off the top of my head what is on the agenda for next week. Does anybody remember? I'll put something out to all commissioners today so you know what's scheduled. Do you have something in mind?
Well, we have the energy audit that we approved last year that we've been talking about. We talked about the history of the Board of Health, those kinds of things. Those were questions that I had that I'd like to put on a staff meeting. I'd like to get that on the calendar, please.
Okay.
Okay. With that, we are adjourned. Thank you.